viewers. Welcome to Cardinal Sign, C-Help's innovative online magazine. We are pleased to have you on this maiden edition of our interview segment. C-Help is an acronym for Center for Health Education and Life Promotion. It is an NGO that is passionate about saving lives through various actions or activities. Today, we started the third C-Help Health Summit, and this interview is coming to you as part of the segment of that Health Summit. I have the honor and the pleasure to interview somebody who is very, very special to me and to a lot of young women out there. She is an eminent personality. In fact, I like to refer to her as a medical icon. She's done so much in her field of study, in her career. She has traveled to other climes in the pursuit of her career. And so there's so much we are going to be learning from her today. She's also someone who has achieved so much in her personal life, juggling her personal life with her fantastic career. She's been so wonderful in doing this. So we are so happy to have her on set today. And with me to interview this eminent personality is Dr. Chantel. Dr. Chantel, you are welcome to this maiden edition of Cardinal Science Innovative Magazine.
Thank you very much, Ma. I'm glad to be here.
Thank you so much. You're welcome. I'm going to allow our special guest to introduce herself. Without doubt, she's somebody who is important in our society, who has a great wealth of knowledge, but I will still allow her to introduce herself. My body is shaking. I want to introduce her. Good morning, Ma. You're welcome to this program. Please, can we know you?
I'm Dr. Tessie Oiza Amadu. I'm an oncologist by profession. An oncologist is actually one who treats cancer. So I actually qualified as a doctor, and after my compulsory internship and then housemanship, I had this very career-turning event in my life, which today landed me where I am. My elder sister, and who happens to be my only sister, she's late now, developed breast cancer. And I think throughout my medical school, I was like, okay, I was still thinking of, should I do gynecology? Should I specialize in obs and gyn, or maybe internal medicine? But that whole event just turned my whole career life in medicine. It just turned it 360. It just changed the whole thing. And that was my journey through my medical career. That was where it started. Of course, I had to, go with her, do everything, And then along the line, after the surgery, and then she was to have radiotherapy, treat her, treat the place with radiation. That was where I had this, it's a rare field. I went there with her, and I just saw all the people there, all the doctors there were male, and I was like, I think this is somewhere and that was how my interest, developed. And since then, I have not looked back. Oncology is my passion. Female cancers are like a thing for me. That's what I do. That's what I live for. All I want to do is make sure that anybody prevent it in the first place, make sure that women know about it, advocate and educate women about the disease so that they don't even need to come to me in the first place. But also to make sure that when they come to me, they are comfortable and then they can get the best that they can. So I'm an oncologist, and then that is what I do. It's my passion, it's my life. Thank you.
Thank you so much, Dr. Tessie Amadu. I'm so sorry to learn about the loss of your sister. The loss of a loved one is usually a very hard thing to to go through. So I'm very, very sorry about that. Most of the time, people are modest. They don't want to tell you everything about themselves. But now that she has introduced herself, I think I can come in now. So like she rightly said, Dr. Tessie Amadu is a radiation oncologist. She's also a nuclear medicine physician trained in Pretoria, South Africa. She's an IAEA fellow. Then she's a mother to 4 wonderful boys. So she's a lot of things. She's an entrepreneur. She's an immediate past Secretary General of Medical Women Association of Nigeria, Kaduna State chapter. And of course, she sits on the board of some other organizations also. She piques our interest because she does all of these things with so much ease and charisma. So we are very happy to have you, ma. Going further, maybe you can still tell us a bit, what exactly does an oncologist stroke nuclear physician do? Is there a middle ground where you can marry these two professions? Thank you, ma'am.
As I said earlier, an oncologist is a doctor who treats cancer. And it can be a radiation oncologist, that's those that use radiation to treat cancer. It can also be a medical oncologist, those that use drugs to treat cancer. And then there's the in-between, a clinical oncologist, which is what I am, and which is what Nigeria trained us to be. A clinical oncologist actually do both. You use radiation, and then you also give, you do the medical part of it also. A nuclear medicine physician is actually a doctor that uses radiation, but in very, very little amount to treat and also to diagnose diseases, especially cancer. So the difference between nuclear medicine and the conventional radiology is that it picks these diseases at very, very early stages because it's more physiological. And so the marrying line between, the nuclear medicine that I did and the oncology is that for most diseases, for most cancers, you need early detection. That's the key thing. If you have to treat, if the patient has developed the cancer, you have to treat. Early detection is the key. When you detect early, you are more likely to get the patient in an early stage where your treatment intent will be cure compared to when you get the patient in late stage. So what nuclear medicine does is that it gives you this edge over conventional radiological imaging. And so you can actually get these cancers in the very early stage. And then you can also follow up the patient so that even when the patient is developing recurrence, you can get it also in a very early stage. So in essence, nuclear medicine gives oncology a very personalized kind of treatment for every patient because each patient is taken as an entity, and then the treatment is personalized depending on what is found. So actually, and there are other branches of nuclear medicine, but I actually focused on the nuclear oncology part of it. So that's the marry line between my practice of oncology and the nuclear medicine. So I do more of investigations that will make me get these cancers in very early stage. And then there are some therapies that I also do, like for thyroid cancers. Thyroid cancers, actually, most times the medical therapy in oncology is not very responsive. Thyroid cancer is not responsive, but they are very, very responsive to radioiodine, which is a nuclear medicine therapy. So those are the places we come in.
Okay. Yeah, please, can you take us through your career development journey as an oncologist and a nuclear physician? Because I'm sure many young ladies and even young men out there may be listening to you to want to learn more. I'm sure it was quite tedious. How did you go?
Okay. Actually, I started out my residency program in the prestigious Ahmadu Bello University Teaching Hospital as a resident in radiotherapy and oncology. And then 2 years later, I wrote my Part 1 exams. And then 2 years after that, I wrote the fellowship exam and I became a fellow of the West African College of Surgeons, radiotherapy. While I was still in residency for oncology, I got a scholarship with the International Atomic Energy Agency, which is an agency that is responsible for the peaceful use of radiation.
So, doctor, what is the high point of the work you do with cancer patients? Can you tell us a bit about the work you do with cancer patients? Thank you.
So basically, as an oncologist, your job starts after the patient has been diagnosed. Of course, the patient must have presented to other doctors, like with a complaint and all that, and they might have been sent for investigations and, diagnosed to have cancer. So where my job starts is when this has been confirmed, the patient comes to me with the results saying this is cancer and it has been confirmed. Then we take it up from there. Of course, what the first thing that's, the most important thing is getting the patient to come to terms with this. And in the Nigerian setting, most of the time, because of maybe education, awareness and things like that, I realize that patients don't really know what's exactly, have really hit them until they get to you. So it's a bit difficult for you because, in fact, some of them even tell you they weren't told, because sometimes breaking the news of, a diagnosis of cancer is so difficult that the doctors might want to pass the buck to you, who is going to finally handle the patient. So some of them just tell you, okay, no, that they told me I need to go and see so doctor, but I wasn't told. So, your job starts from there. So, of course, it's not just starting the treatment, because you have to get the patient to come to terms with that diagnosis, come to terms with the fact that I have a cancer diagnosis and then it's a life-changing event. And you need to make your patient have an insight, because if the patient doesn't have an insight of what it is, patients will not cooperate. And in treating cancer, you actually just need that cooperation of the patient, because if the patient does not cooperate, then you don't go anywhere. You lost the patient to follow up. Meanwhile, your cancer patients are lifelong patients. You don't lose them. They are, because you need to follow them even after they have completed their treatment, because you know that even if it is 10 years, 12 years, 15 years down the line, they can come back with recurrence. So we don't discharge patients. So that means it's very, very important that the patient has an insight of what disease, what he or she has, and then the journey. It's a life-changing journey. So, and then they have to come to terms with it. Or else, if you don't do that before you start the proper treatment, the patient starts, and you lost the patient to follow up, because she doesn't understand the reason why she needs to come. She must come back to you. So that's the first thing. That is what you need to do. When patient, in fact, some of them have to go, come back to you, go think about it, inform their families, because family members have to be involved in this thing. It's not a journey that one can go alone. Family members need to be there, close relations to help in so many ways. And so after this has been done and patient has an insight and patient accepts, because there has to be a consent to the treatment. Remember that most of these treatments, in quotes, are not palatable. Most times I tell my patient the treatment is not palatable, but what you look at is the fact that what do you want? Is the benefits greater than the risk? Is the benefit of having this treatment greater than just leaving it to follow the natural course of the disease? Of course, the benefit of taking the treatment is far outweighs leaving the cancer to live its natural course in you. So, those are the things that you make the patient know, and then the patient gives an informed consent, and then the journey through the treatment, because the treatment is also not a one-time treatment. The treatment is a cyclical treatment that takes sometimes almost between 6 months to 1 year. So the patient needs to know, what they're going through. Apart from the patient knowing even where the patient works and everything. So it affects almost everything about the patient. Some patients might not be able to go to work for a whole year when they are on this treatment, because you give the treatment, patient is like a bit sick or not up with the weather for like a week before they come up again. And then by the time they start recovering, it's time to take another one. So all these things make like everybody has to come on board, even where the patient works, the patient's relative, people that will take care of the patient, they need to know that it's not a one-time thing. They have to be there for this patient for a long time.
I can imagine the burdens that you have to carry, the burden of the diagnosis itself, the burden of counseling patients, the burden of supporting them through the treatment. Wow, it's not easy. I think an oncologist needs a large heart, a large compassionate heart. Well done, ma'am.
Thank you very much.
Now, having said all of this, I think I begin to understand why some doctors eventually have what we call burnouts. So I don't know if you've experienced it before, and how do you cope?
For that, I think I have over and over and over again, but I think I'm getting used to it now. Most of the time, the burnout comes from the fact that you're here with patients, especially I'm talking about the Nigerian context now. You're here with a patient, you need to help. This is a disease that is like, it's a chronic disease now. Of course, it's been lumped up with things like diabetes and hypertension and things like that. And you're looking at a patient that is going to be with you for a long time. You're looking at a patient that you hope would recover and, move on in life to, whatever they have planned for themselves and all that. But I think my greatest downside, as in what gives me that burnout, is the fact that we do not have those things, the right facilities to do your work. So you find a patient and you're like, okay, I want to do this. This is what I'm supposed to do. But of course, facilities and all that are not there for you to do that. And then even if the facilities are there, another thing that you also struggle with is the fact that patients don't have the money, patients don't have the funds to, go all out to do these things. There are treatments that can take you almost ₦1 million every 3 weeks. No any average Nigerian. In fact, sometimes I tell my patients, before I tell them the cost of this, I tell them, I say, even me as a doctor here, seated in front of you, if you tell me to bring out such money every 3 weeks for 18 months or something, I might not be able to afford it. It's crazy. So those are all the things that, give you that. But I think with time, you just see yourself trying to find a way to, get to the middle of it. Sometimes you even have to do some form of finance for your patient. Okay, you look at it, you want to prescribe this drug, but you know that this patient cannot afford. In fact, you find yourself asking, what do you do? Sometimes our patients are not happy about it, but they don't understand that you really want to have an idea of what they can afford. And yes, because remember that this treatment is something that if you start, you shouldn't finish, you shouldn't stop, or else there's a rebound. So you want to look at it and ask, where is your source of fund? Do you have support? Will you be able to do this? Will you be able to, complete 6 or 8 cycles of this without any break? So you find yourself doing some form of economics, some form of permutations, just to make sure that your patient. So I think to me, that's really the downside of it. If I have the facilities where it's supposed to be, and then you are maybe in a place where the patient does not need to think about the funding, then I think it will be much more interesting. You'll be, it will be better.
Yes.
Yeah, it will be more fulfilling.
This situation occurs in almost all aspects of clinical practice in Nigeria, and even in other sectors too. Lack of fund is a big problem in this nation. At the beginning, when you were introducing yourself, you give us an insight into what influenced your choice of career. You talked about the loss of a dear one. If I won't be asking too much, maybe if you can help us and talk to us just a little bit about your sister.
I think she came, she saw, and she conquered. So most of the time when I want to talk about my sister, I actually use her as an example to my patients. I tell my patients when they come, I said, I am in this journey with you, not just because I'm a doctor. I have gone through it. Like, my sister was once a patient in this same place where you are. Like, I just give them that, just try to tell them that it's not a new thing, it's something that you can go through. So my sister was, of course, she was my only sister, and she developed breast cancer at 31, actually. She was quite young. After her third child, she was breastfeeding her third child when she actually noticed the lump, and then we started. And that was how the journey started, actually. She had her surgery. It wasn't delayed because the husband is educated and he knew, so we didn't have problem with, consent or anything. All they wanted was for her to just be, well and all that. But, so she had her treatment, everything was fine. She actually died at 41. So like 10 years, I think, she really, she lived well. She was a good survivor, but I think 8 years after the first treatment, of course, I said
she went into remission?
She went into remission. She was fine. She went back to her work. She was a poultry. She read agric, and so yes, she was a poultry farmer. She had a big farm that she employed people. In fact, agric students do IT in her farm.
Wow.
So it was that big. And so when she went into remission, she went back to her normal life and everything. But I think 8 years after the first treatment, then she developed a spread to the lungs. And even after that, she, had more treatment again. She lived for another 2 years after that. But of course, she succumbed to the disease. But she was a fighter.
Wow.
And so I think from 31 to 41, and every time I think about her, I think about the children. I remembered her first daughter was 8 when she was diagnosed. Her first daughter was 18, was already in the university. Second daughter was already in university. So I think she had time. She had time. And one thing cancer does for you, and that's what I tell my patients. I said, see, the only difference between you and somebody else is the fact that you know that you're going to die. Yes. So you have it in mind. But everything you do. I said, and I think you're better off than I or any other person that just feels, oh, I still have 100 years. You are more intentional. So I use that to encourage them that it's not the end, because people just feel cancer equal to death. So, but when you look at it that way, that, okay, now it makes you closer to your God. It makes you more intentional in all that you do. Then I think that way you can, live life, very intentional, and then you do things the way you want to do them.
Wow. It must have been very devastating to lose a sister.
Yes, it was, because my sister was my support. Like when I was doing residency, I had no problem because she was just there. She most of the times when I have my exams, I just go drop my kids there and forget about it. In fact, there's this school where my children attend when they are there. They know. Once I come to drop my children, they know. They just accept them because so they were just like that. And when she actually died, I was in South Africa, so I had to come. I wasn't around that period, so it was really, really. But I think a month before she died, I came and all that. It was really devastating, and I have lost a very huge part of me. But I think God has been faithful.
But are you afraid for yourself?
Yes, I am. Of course, I am. Another thing I tell people is that sometimes you say ignorance is bliss. In this aspect, is actually bliss. Because when my sister had cancer, I think I was more afraid for her than she was for herself. Of course, she most of the time she didn't know the extent. But I knew when she was in remission, I actually knew that something can still come up. I knew that, of course she was living her life like, okay, she's been cured and blah, blah, but because it's my field, I know that, something can still crop up and all that. But of course, you always want to live your life with faith and all that. And then for me now, because most of these cancers, you have family history as one of the strong points and all that. So most times I'm like, I see my patients, I'm like, And this, you know, like when I'm telling them, okay, do you have a relation with breast cancer? And they're like, okay, yeah, I'm talking to myself. So like some of the times I but of course it makes me do what I'm supposed to do.
Yes.
I don't waste time. I do my screening when due and all that, so that I just at least do my part of the whole thing and then leave the rest to God.
So as a cancer specialist, how has her life and her death impacted the way you manage your patients?
It has strongly impacted, like my management skills. It has helped me to personalize my patients. It has helped me to go on this journey with my patients. I can assure you that, especially breast cancer patients, I think maybe I'm more because she had I have a bias. And in fact, even everything I do, most of my studies, most of my work, like even my dissertation for my 2 resident programs were all on breast cancer. So like, I think especially for that, but it has made me, like most of my patients are like, like most times I just personalize them. I just see them as my sister. I see them as, like the journey I went through with her. I keep, doing it over and over. Yes, I would say it's a good thing, but in another side, it affects me because at the end of the day, I get too close to these patients. I have a lot of female patients that I am so close to because of, the way you handle them and all that. So they become more or less like relatives, like sisters. But I think by and large, it really, really affected my choice of, specialization, what I want to do as an oncologist. Do I want to do breast? And of course, I added the other gynecological tumors because they're females, but mainly, affected my choice of treatment, also affected the way I go along with my patients. I don't just ordinarily say, okay, prescribe this drug, okay, go and take it, because I know what, the other things that come with it. I travel the journey with them.
Okay.
Yeah.
Any plans to immortalize her?
Yes, it's not formal yet, but I think I am already doing that. It's just that I have not formalized it, but I think all that I do, I have not come out to say, okay, I have this foundation in her name and all that, but all that I do is in memory of her. Like I go all the way in memory of her and all that, but it's still coming. It's coming. I just need to clear up 1 or 2 things, and then I would focus on that.
So what message do you have for people out there living with cancer?
For people out there living with cancer, I want to tell them that they are great people. They are survivors. They are our heroes and sheroes, if there's anything like that. They are strong people. It's not easy to go through this thing, especially children that cannot talk. Like I just wonder what they go through, So I will just want to tell them that they are great people. To go through the journey of having cancer and living with it, because rehabilitation into the society after your treatment is something else. Let's not talk about the psychological thing. Let's not talk about all that it does to your body and some of the things that you cannot regain back. But they are heroes. They I don't know, they just define the journey. They define the journey called cancer. I know along the way we lost some, but those survivors, and I also want to encourage them that their stories are actually what others will use to survive. So they shouldn't give up. They should always try to, lend their voices. It's very important. When people see that, this person, I have gone through it and there's really, it's something that you can do, they also want to come out. So that advocacy, that's, lending out their voice to see that they support those that are coming behind them, it's very important, but they are just the heroes.
So what suggestions or advice can you give to the government of Nigeria with respect to cancer treatment, to be able to achieve the health system of our dream in Nigeria?
I think you have said it all, that it's a problem with facilities and things like that. It's a problem in every field in the health sector. And I will say it again. I think the most important thing is funding. Funding. It's sad enough that a patient has a disease, but it is more traumatic when you think of how are you going to fund it. Now you're not thinking of, oh, I have a life-threatening disease. You're thinking of, how am I going to go through this journey? How will I fund it? It's not funny. It's not cheap. Cancer is not a cheap disease, I tell people. No matter how rich you are, it's going to touch your pocket, because there are a lot of things to, there's surgery. It's multimodal. It's not a treatment, it's not a unimodal thing that is just one, okay, you take drugs and you're fine. There's surgery, there's radiotherapy, there's chemotherapy and all that. And so it's not just a cheap disease. So funding. I know that NHIS is trying to do that, but how many people are under the NHIS system? There are not a lot. So how do we get the government to fund cancer treatments? It's very important. We need to look at it. Everybody keeps shouting NHIS, but how many people access NHIS? So other things have to come on board. The government have to look for ways that these things can be subsidized also. I know that there are drug companies that are doing well. In fact, they are forced to subsidize their drugs because patients cannot afford it. So, they bring out a lot of, innovations, like, okay, buy this and then we'll give you, maybe buy 2 and then we'll give you 1, or we'll subsidize your treatment or things like that. So I think another way, apart from the NHIS, because of course NHIS is coming on board, but it's not serving a lot of people, so it was still going to get back to square one.
But does NHIS cover things like radiation?
Yeah,
radiotherapy.
Radiotherapy. I think for now it's just one hospital I'm aware of that it covers. That's National Hospital Abuja. I don't think it covers in other places, but I think they're trying. And then even the drugs, there are some drugs that have not come on board. I don't think all those drugs that are like 1 million plus, 1 point something million have come on board. But I think it's a gradual process. So we have to look at other ways of funding apart from NHIS. And then the second thing that the government needs to do is facilities.
It's very important.
Apart from having cancer, apart from thinking of the fund, sometimes you have the fund, but you're thinking of where do you access it. The waiting list is so long, it is crazy. And cancer is one disease that it doesn't wait. So we have that as a big problem. You find a patient living in Calabar having to come all the way to maybe Sokoto or Zaria for radiotherapy, like from one end of the country to another. So facility is another thing that has to be looked into, and the government, now PPP is coming on board, and many private are getting interested in these things. I think those are the things that would help us to sort out that, but the government needs to equip our centers.
Wow. Thank you so much. I hope you're not too tired yet, because
not
Dr.
yet.
Chantel is here and she's been waiting to take her turn as they are asking you some questions. So,
thank you.
Dr. Chantel.
Okay, thank you so much. You have asked basically so many questions, but I'm sure the viewers can see why she's very well respected. She's a smart woman. She's a mentor to a lot of young ladies. Not just young ladies, even young men.
Yes.
I've had some colleagues that talk so wonderfully well about her, and I'm sure you can see why. The first time, even before I came to ABU, the first time I heard, I didn't even know her, but I knew the story of her sister. I read it on Facebook, and that story touched so many people. Yeah, I think as at that time, maybe 4 years ago, 5 years ago, when I saw it, it had about 35.
That was on Fin.
Yes, on Fin.
On Fin, yeah.
It had about 35,000 likes as at that time. I don't know how many likes. That story, so definitely your sister lives on. The only question that I have, because so many questions, even the ones that I had in mind have been asked. The only question I have is, what are your plans for the future? Not just medical-wise, not just with regards to cancer. Like I said earlier, you mentor to a lot of people. So what do you plan, the future, your plans, continued mentorship, then cancer and the rest?
The future. Okay. The future looks bright. My plans for the future, I would say in summary, I want to be the best that I can be in future. And of course, as you said, it's not just cancer. But for cancer, I think I would want to see myself as high as I can be in this chosen career. I will want to contribute as much as I can in the field of research, in the field of support, lending my voice for anything that has to do with cancer, both formally and informally. In fact, the informal ones are actually the best, not the formal one that you go, you write things, you write proposals, you write this and that, and then it takes another 4 or 5 years. Those informal things you do, reach out to people in churches, in mosques, in, people around you, take phone calls, and, those are the things that keep me going. I must be truthful to you. And then I would also want to be involved in most of the researches that would give us groundbreaking results. So basically for cancer, I just want to lend my voice, both formally and informally, but of course, mainly informally. And then I think for my career, I would just want to reach the height of my career. Do researches concerning cancer especially, and then of course collaborate with people, collaborate with a lot of, because cancer is multimodal, so collaborate with as many people as I can, as many organizations and that I can, to lend my voice. Right now I'm the project coordinator for this same organization that sponsored me for a specialization. Yeah, there's a IAEA. Yes, I'm currently the project coordinator for Nigeria for. They're trying to see if we could bring up cervical cancer prevention and treatment, and so there are a lot of sites and a lot of things, a lot of ongoing training for that. So both nationally and internationally, I would just want to lend my voice, work to make sure that cancer, we bring cancer to the barest minimum. And most importantly to me, I am somebody that is very, very passionate about passing down knowledge. I want people, I encourage people, I want to encourage people to do even greater than I have done. The people coming behind are, whether we like it or not, they are more exposed to things that while we were here, were not. So mentorship is a really, really, really big part of my journey. Both formally and informally too. And then mentorship, informal mentorship, again, I think maybe I am one person that is passionate about doing things informal, because I think the informal things actually gets more results than those formal ones that you say, okay, I'm your mentor, come so time, let's sit down. No. Those mentorship that you do without even knowing, okay, no, but you need to do this, oh, you can do this, you can do that. I think those are the things and so I am very passionate about mentoring people coming behind me, my residents, my friends, people, even those that are not in the same setting with me, but they can draw one thing or the other from me and learn from it. So mentoring is another thing that I see myself in the future, really, really making it a big deal in my life.
Thank you very much, Ma.
Thank you.
Is that all?
Yes.
I thought you had plenty questions.
So you've asked them.
Okay. So maybe before we let you go, what would be that one thing that you tell every every woman to do with respect to prevention of cancer?
Okay, with respect to prevention of cancer, I would tell, I used to say, okay, go for screening and all that, but I think now, what I would say to every woman is that you need to be knowledgeable. You need to know. If you don't know, so if I tell you need to screen and you don't even know what to do, you will not even know. So I think the first thing I would say, yes, it's good to screen, but the first thing I would say is that you need to be aware. That's the truth. No matter how educated you are, if you're not aware of some things going on around you, it's good. So I have just realized that awareness is one thing that we need to hammer on. It's not go and screen. There are a lot of people that, know that these screening programs are going on, but they are not aware of what like what the implications are and things like that. So I think the most important thing I will tell every woman today is, please be aware of what is going on around you. If you're aware, and we're in the age now with technology, like you can just Google. And so most times I tell my patients, see, in order for you to, like go along with me, let's go in the same pace. Go back, when I tell you this, go back and go and Google it and look at it. If you don't understand, ask me, okay, doctor, you said this, but I read this and all that. I think it makes it a lot easier. So I would say, women, let us be aware of it, because we are like the, center point. If you are aware, your husband will not develop cancer, your children will not develop cancer, you will not develop cancer. So I think that's where that's what we need to hammer on first. Be aware. And of course, when you are aware, you will know that you need to go for screening. You will know how dangerous this thing is. You will know how effective it is to actually prevent this thing than to treat it. So a lot of things, you even know the benefit of getting it in an early stage. But if you're not aware of all those things, yes, you know that there's a screening site to do cervical cancer, to do a pap smear. I'm telling you can be there 5 years, you will not do it. Exactly. Because you're not aware of the dangers. You are not even aware of what can happen to you if you don't go to get that test. So I think awareness is the key. Let us be aware of our environment. Let us be aware of everything that is going on. Read, get educated about these things, and then we'll bring cancer to the barest minimum.
Thank you so much, Dr. Tessie Amadu, for educating us this afternoon. It's been a very wonderful session with you. We are very grateful that you took time out to be here with us today. We want to talk to ladies out there. If you don't go home with anything today, please go home with this last message. Be aware, get knowledge, save yourself and save your entire family. If you want to learn more about cancer, join us on Saturday afternoon on Facebook Live. I'll be there live and direct with Dr. Chantel to tell us about the preventive measures we need to know about to kick cancer away. Live streaming on Saturday morning for our exercise session. By the way, that will be our 5th annual cancer awareness campaign. It was initially meant to be a roadwork, but because of the situation in the nation, we are going to be having a virtual event. So try your best to join us online. Put on your pink t-shirt or pink blouse, whatever, and come out there and jog for life. And see you on Saturday. Bye-bye.